Hello, this is Rashi Sahai, and you're watching Medicircle. Today, on our Children's Health Awareness series, we have Dr. Kiran Kinger with us. Dr. Kiran Kinger is a managing director at Kinger's Kids Clinic, Bangalore, and for the past 27 years, he has been working in this field. Welcome to Medicircle, Dr. Kiran Kinger.
Thank you, Rashi, and hello, everybody.
So, statistics have revealed that jaundice in newborn is most common compared to toddlers and adults. Around 60% of the newborns are likely to experience jaundice symptoms. So, doctor, can you please tell us what is jaundice and what are the causes and symptoms of jaundice in a newborn child?
Jaundice is simply yellow discoloration of skin. Jaundice by itself is not a diagnosis or a disease per se. Jaundice is more like a symptom or a sign. See, when you look at the newborn babies, they are a special category and they have a special type of jaundice, which is called neonatal jaundice. Now, you cannot compare this jaundice to the other jaundice, which is due to liver disease in older children as well as in adults. So, when we talk about newborn jaundice, we are talking about an entity called neonatal jaundice, which is very important and specialized in its own way. We don't confuse it with the adult or the older children jaundice.
So, what precautions should one take to prevent jaundice in infants?
When a healthy pregnant mother is going through good obstetric care, and when the obstetrician has taken care of the unborn baby, if there are certain factors when the fetal health has to be looked after, the obstetrician will refer the mother to a fetal medicine expert and make sure the jaundice is not ignored at the time of birth. For example, when the mother is not healthy during the pregnancy, or if she is a negative blood group mother, she will need extra care, and so will the baby who is going to be born will need a very specialized good center to take care of the newly born baby. So these are the precautions you should start right at the pregnancy level and during the pregnancy with the obstetrician and the fetal medicine expert. And especially perinatally, the mother should not be sick. Therefore, the baby will not be born sick. A sick newborn is more likely to get jaundiced as compared to a healthy newborn. So healthy newborns are healthier. A sick newborn will need special care, including neonatal intensive care. That is a specialized category which should be alerted. So prevention comes in being alert.
So, how to treat jaundice in newborns?
By ensuring that the baby is feeding properly, as well as starting a blue light therapy called phototherapy. Now, phototherapy is given on the skin of the baby, either on the back or from the top. And that treatment of phototherapy is what will treat the jaundice so that the yellow pigment will come out in the urine, converting the yellow skin back to normal. So it is treatable with phototherapy and good feeding.
So, doctor, how can one tell if the jaundice is getting worsened?
Baby will look sicker and more yellow, and the blood test will be showing the indicator that the jaundice levels or the bilirubin levels are going high. So testing is done in the babies to examine how the baby is doing, as well as a blood test is required just to measure the amount of bilirubin in the blood, which will guide the pediatrician and the neonatology doctor to treat the baby.
So, doctor, how often should one feed a child during this illness?
Feeding should be approximately every 2 hours, but sometimes the baby will take a small feed, and therefore feeding should be given regularly at even smaller intervals, even smaller amounts, so that the baby is well hydrated. Even if the baby is well supported with feeding, that itself can solve the problem of jaundice by good feeding. So it should be fed fairly frequently.
Okay, doctor. So on Medicircle, our main focus have always been to provide the audience with large amount of information in less time. And so today we will be conducting a small rapid fire question answer session in which you can either answer in yes or no, or one or two line answer will also do. So doctor, do infants need a special attention during jaundice?
Yes, special attention to hydration, including feeding and monitoring.
So is jaundice the life threatening for a baby?
If it is untreated, unrecognized, and not taken care of, it can become.
So how long does jaundice last in a newborn child?
It can range from few days to few weeks, provided it is given the care and the attention, it will resolve.
Okay, doctor. Thank you so much for coming to our show and sharing your valuable time and insights with us at Medicircle.
Lovely talking to you, and thank you everybody for your time and attention.
Thank you.
Bye bye.